Total hip arthroplasty phase 2. Once the patient has sufficient muscular strength and range of motion, they can be progressed to phase 2. The physical therapist should focus on functional exercises for strengthening and also implement balance with proprioception. Standing hip extension. The patient should be standing next to a sturdy object that they can use for support if it is needed. The patient should stand with a neutral spine. To complete the exercise, the patient will simply extend their leg as far back as possible before they need to compensate through back extension. The patient will then use an eccentric contraction of their hip extensors to slowly allow their leg to return to the starting position. Single leg balance. The patient should be standing next to a sturdy object that they can use for support if it is needed. The patient should stand with their hands on their hips and maintain a neutral spine. To complete the exercise, the patient will simply lift one leg off of the ground. The physical therapist should cue the patient to maintain a level pelvis while making sure that the patient does not excessively lean over their stance leg. Wall slides. The patient will stand with their back against the wall. The patient's feet should be between hip width and shoulder width apart. Their feet should be far enough away from the wall so that their knees do not shoot past their toes as they flex their hips and knees. The squat is complete once the patient's knees reach about 45 degrees of flexion. Once the patient's knees reach 45 degrees, the patient will then return to their standing position through hip and knee extension.